Welcome to the training, Replacing Durable Medical Equipment and Prescription Drugs After a Disaster, addressing the needs of Medicare beneficiaries. Please review this disclaimer. This presentation was current at the time it was published and uploaded. Policies change frequently, so it is important to stay current by checking the Centers for Medicare and Medicaid Services website at cms.gov. Here are instructions on how to view this training. This training is designed to be watched in order. You can pause and play again as necessary if you would like to take a break. This training was developed through a partnership of two agencies within the U.S. Department of Health and Human Services, HHS, CMS, and the Administration for Strategic Preparedness and Response, ASPR. This training describes the Medicare Fee-for-Service, Medicare Advantage, MA, and Prescription Drug Plan, PDP, programs, and information about access to durable medical equipment after an emergency. This training is for emergency responders and volunteers. It is for individuals who work closely with beneficiaries after an emergency, including disaster care managers, FEMA disability integration specialists, the Medical Reserve Corps, and others who support emergency response and recovery. This training provides information on replacing durable medical equipment and prescription drugs that may be lost or damaged due to an emergency. The information provided is for assisting survivors to reconnect with their health care so that they can begin the recovery process. This training provides information on Original Medicare, also called Fee-for-Service Medicare, Medicare Advantage plans, and Prescription Drug Plan programs. The focus of this training is to share information with stakeholders about the disaster recovery phase. This is not intended to cover immediate needs as a disaster is occurring. Additional resources and contact information is provided for assisting survivors. First, let's define DME. DME stands for Durable Medical Equipment. It includes equipment like wheelchairs, hospital beds, oxygen equipment, diabetes supplies, CPAP machines, and walkers that are used in the home. Many people with disabilities, people with chronic health conditions, and others with access and functional needs commonly use DME and prescription drugs. CMS administers Medicare and Medicaid. These two federal programs are often confused. Medicare and Medicaid are two government programs that help people get health care. They are different in a few ways. To assist Medicare beneficiaries, let's ensure a good understanding of what Medicare is. Medicare is available to people who are older, disabled, or have specific chronic illnesses. Medicare benefits are federally funded and administered by the federal government. For Medicare, there is no financial test to qualify, but there are eligibility requirements. Medicare beneficiaries can choose from two different programs. 1. Original Medicare, also called Fee-for-Service Medicare, and 2. Medicare Advantage, MA, also called Managed Care Plans, or Part C. Beneficiaries also have the option of adding Prescription Drug Plan program coverage. Medicaid is for people with limited resources. Medicaid is administered by individual states. To qualify for Medicaid, income and asset tests vary by state. Medicaid programs are paid through a matching program between the federal government and state governments. This training will focus on Medicare. The following are examples of emergencies that can disrupt healthcare: natural, technological, and other public health emergencies, PHE. Examples of natural disasters include hurricanes, floods, tornadoes, wildfires, extreme weather, earthquakes, and volcanoes, where the possible disruption of healthcare is high. Technological emergencies, such as bioterrorism, power outages, cybersecurity breaches, and nuclear accidents, can also disrupt healthcare. Finally, there are other PHEs like flu pandemics, the Ebola virus, COVID-19, and the Flint water emergency. Healthcare disruption from these types of public health emergencies is a little different, but can also impact healthcare. This is a video of the damage caused by flash flooding in Ellicott City, Maryland in May 2018. It provides a visual example of the devastation that can be caused by natural disasters. People who use DME or take prescription drugs can be at greater risk of harm in some emergencies. With the loss of building and damage to vehicles, some individuals stand a greater chance of losing or having damage to products they use to maintain their health and independence. So as you can see from that video, some emergencies can be quite devastating. People may experience different impacts due to an emergency, like evacuation from their home or relocation, both of which are disruptive. Belongings in one's home may be destroyed, like an insurance card, medical equipment, or medication. Some people may experience hospitalization due to injuries. In addition, healthcare services like hospitals or practitioners' offices may be unavailable for care. Most importantly for this training, DME and prescription drugs may be lost, left behind, damaged, or destroyed in an emergency. Again, for the purposes of this training, we are focusing on disaster recovery. You may ask, who is impacted by a disaster? Almost everyone in the impacted area could be at risk of losing property, incurring physical harm, or having difficulty accessing healthcare providers. In addition, systems can be disrupted. For example, someone could lose an ID card or forget their DME. People may not be able to access items that are lost. At-risk individuals are people with access and functional needs, temporary or permanent, that may interfere with their ability to access or receive medical services before, during, or after an emergency. This can include difficulty getting their usual healthcare services. During an emergency, it's important to recognize that at-risk individuals may need additional assistance. This can include people who use DME or prescription drugs. People with access and functional needs may need assistance due to any condition, temporary or permanent, that limits their ability to take action in an emergency. As stated before, access and functional needs may interfere with a person's ability to access or receive medical care. People with disabilities, people with chronic health conditions, and others with access and functional needs may need support to maintain access to healthcare services or assistance to address restrictions or limitations. Individuals may use DME or prescription drugs for a number of health conditions, which can include the following. Mobility limitations. For example, someone recently discharged from a hospital might use a wheelchair or walker, such as a person who recently had knee replacement surgery. Diabetes, which is a chronic health condition that may require people to use prescription drugs or supplies to regulate their insulin levels. COPD and other chronic lung illnesses may require people to use equipment to prevent sleep disorders or to help them breathe. While many conditions require DME, some conditions require prescription drugs. Medicare beneficiaries may have DME, prescription drugs, or both. These may be lost or damaged in an emergency and require replacement to maintain a person's health. A common problem during and after an emergency is that people with Medicare who utilize DME or prescription drugs may not self-identify or recognize that they have additional access or functional needs. However, disaster survivors with access and functional needs may experience greater impacts because of disruption to their healthcare. People with disabilities, people with chronic health conditions, and others with access and functional needs may have difficulty maintaining their health and independence without their DME or prescription drugs. An at-risk individual who is experiencing difficulty accessing DME or prescription drugs could experience adverse health outcomes. For example, if there is a delay in replacing DME or prescription drugs, a Medicare beneficiary may risk acute illness, the need for hospitalization, or recurring hospital stays. If replacement of donated DME is provided and a Medicare beneficiary does not seek a permanent replacement later, they may experience difficulty getting needed repairs or supplies through their insurance program. Overall, there may be confusion about whom to contact. There is a simple solution, which is to reconnect people to their healthcare coverage, services, and products that they had prior to the disaster. The ability to maintain or reconnect one's healthcare can be disrupted in an emergency. Many people with disabilities or chronic health conditions get their healthcare services through Medicare. The next part of the training describes what Medicare does to assist individuals when there is a disaster, and if their DME or drugs are lost or damaged in an emergency. DME and prescription drugs can usually be replaced. We are going to discuss how to identify someone who has Medicare and provide information on how to best get them resources that will quickly help them access their healthcare and gain access to their DME, or prescription drugs. Here is a video demonstrating what can happen to someone after a disaster if they rely on DME, such as oxygen.
Let's take things on a lighter note here. Out of all of our coverage today, now this story perhaps warmed all of our hearts in the newsroom and many of our viewers.
It sure did. Well, out covering power outages, Carice Jackman and photojournalist Neil Giarratano came across a woman in Treme who relies on an oxygen machine to breathe. Well, after she appeared on our air, the amazing people in New Orleans, of course, stepped up to help.
Now, here's how it all happened.
Tell us about your situation. When did you guys lose power?
The power went out 2 hours ago, and I'm on oxygen. They have to hurry up and turn it back on for me, please. Yeah. Because it's getting warm and it's hot, and my respiratory is real bad.
Everybody in your block is off too?
Everybody, on through Maine, St. Anne, everywhere.
And I know you talked about how it's a dire situation for you because you don't have any oxygen right now. Mm-hmm. Is that a big problem or a big concern that you felt when we started hearing that the storm was coming?
Yeah, it was, but where could you go, It's from Katrina to now, and I'm real sickly. I can't move around like that.
I've been taking care of her, making sure she's straight, making sure she got water, food.
Do you think you may have to take her to your place soon?
Yeah, if it get bad, the weather's bad, I will.
If not, I'm gonna go to her house.
Because she can't stay in these conditions, huh?
No, because she need her oxygen machine.
Any message you'd like to give to somebody, Entergy, the city?
Please come turn our lights back on, please. If y'all could, please.
We just got a call from the administrator of the medical center in Gentilly who wants to get an oxygen tank to the lady without power. You interviewed a little bit. His name is Malcolm, and his number gave me his number. What do you think about that?
Thank him so much. I'm blessed. I'm just feel blessed. Thank y'all so much. It's hard. It's really hard. And when y'all left, my cousin came and bought me this one. And I'm so thankful that y'all stopped to help me, to talk to me, to find out what was going on. And y'all got some stuff kept rolling around up in here, It's really hard when the storms come, you want to evacuate, but you can't. It's hard. It really is. And I really appreciate y'all and thank y'all so much.
Absolutely.
And Malcolm, thank you.
Oh, I love that so much.
So great. And it took was her stopping and saying, how are you? What can I do for you?
Exactly.
And then the city shows up big time, like the city always does.
And we've seen so many people do it across the city.
Incredible, amazing acts of kindness today.
This video is about a woman who is without electricity after Tropical Storm Barry hit New Orleans. She uses oxygen, but without electricity, she cannot use it. After her live news story, a hospital in New Orleans offered to help her get access to oxygen. Most individuals that use oxygen are in contact with their suppliers. The supplier is responsible for making arrangements for the beneficiary's needs before an emergency. CMS policy on replacement of DME is a standard policy that is available for beneficiaries that have DME that has been lost, destroyed, or damaged. However, during many disasters, additional flexibilities may be made available through a waiver process. When the President declares a disaster or emergency under the Stafford Act or National Emergencies Act, and the HHS Secretary declares a public health emergency under Section 319 of the Public Health Service Act, the Secretary is authorized to take certain actions in addition to their regular authorities. For example, under Section 1135 of the Social Security Act, the HHS Secretary may temporarily waive or modify certain Medicare, Medicaid, and Children's Health Insurance Program (CHIP) requirements to ensure that sufficient healthcare items and services are available to meet the needs of individuals enrolled in Social Security Act programs in the emergency area and time periods, and that providers who provide such services in good faith can be reimbursed and exempted from sanctions, absent any determination of fraud or abuse. Other examples of permitted Section 1135 waivers or modifications include the following: conditions of participation or other certification requirements for healthcare providers, program participation and similar requirements for healthcare providers, pre-approval requirements, requirements that physicians and other healthcare professionals be licensed in the state in which they are providing services, so long as they have equivalent licensing in another state. This waiver is for purposes of Medicare, Medicaid, and CHIP reimbursement only. State law governs whether a non-federal provider is authorized to provide services in the state without state licensure. Emergency Medical Treatment and Labor Act EMTLA sanctions for redirection of an individual to receive a medical screening examination in an alternative location pursuant to a state emergency preparedness plan. Limitations on payment to permit Medicare Advantage enrollees to use out-of-network providers in an emergency situation. These waivers under Section 1135 of the Social Security Act typically end no later than the termination of the emergency period. Next, we will describe reconnecting people with Medicare to their healthcare services. We will start by discussing Original Medicare. You can see in this picture that in the event of a disaster like a wildfire or tornado, someone's wheelchair or prescription drugs could be damaged or lost. In the aftermath, you may encounter people seeking assistance to replace their DME or prescription drugs, which we will discuss later. We will first discuss Original Medicare. Medicare is the federal government healthcare insurance for 1. People age 65 or older, 2. For some individuals under 65 with disabilities, and 3. People of any age with end-stage renal disease or kidney failure. Original Medicare is comprised of 2 parts: hospital insurance, which is Part A, and medical insurance, which is Part B. The Medicare Part B program includes and pays for DME and some pharmacy-dispensed drugs, such as immunosuppressants. Later, we will discuss both Part C, or Medicare Advantage, which is when private insurance companies cover the benefits that are covered under Parts A and B, and Part D, or prescription drug plans, which is when private companies cover prescription drugs not covered by Original Medicare Part B. Original Medicare pays for many types of DME for Medicare beneficiaries. Medicare beneficiaries may need DME as a result of an acute injury, a chronic illness, after having a medical procedure, or because of a disability. Original Medicare pays for DME. Part B pays for medically necessary, provider-prescribed DME for use at home. Most people with Original Medicare have Part B, so their healthcare benefits cover access to provider-prescribed DME. Let's discuss how Medicare pays for DME. Original Medicare, particularly Part B medical insurance, pays for many types of DME for people with Medicare. As discussed previously, people with Medicare may need DME as a result of an injury, a chronic illness, after having a medical procedure or surgery, or because of a disability. People with Medicare get their DME from DME suppliers, which are companies that work with Medicare and other insurance companies to supply people with DME they need. Medicare will only pay for DME if the prescriber and DME suppliers are enrolled in Medicare. If not, Medicare will not pay claims submitted by them. Some DME is furnished by contracted suppliers. Beginning in 2021, off-the-shelf back braces and off-the-shelf knee braces are supplied by contracted suppliers in certain areas of the country. Beneficiaries needing to replace these products as a result of a disaster should work with their supplier and call 1-800-MEDICARE. Medicare pays for replacement or repair of most DME and replacement of prescription drugs when the equipment or drug is lost, destroyed, or damaged. Medicare has standard policies in place to process disaster claims. If the DME is lost or destroyed by an emergency without a presidential disaster declaration, the equipment can be replaced through standard procedures. Medicare pays for the replacement of equipment or items which the beneficiary owns, is oxygen equipment, or is a capped rental item when the equipment or item is lost, destroyed, irreparably damaged, or otherwise rendered unusable. Medicare does not pay for the replacement of items that require frequent and substantial servicing, as defined in 42 CFR 414.222. If equipment is rented and it is lost due to an emergency or disaster and needs to be replaced, payment for the equipment is made by starting a new rental period. For example, if the beneficiary needs replacement of a capped rental DME item like a CPAP machine, a new 13-month rental period would be established. Payment for complex rehabilitation power wheelchairs would be made on a lump sum or rental basis. A common type of DME is oxygen equipment. Medicare covers all types of oxygen: concentrated, liquid, gaseous, and portable oxygen contents. If oxygen equipment is lost, damaged, or destroyed during a public health emergency with a presidential disaster declaration, the supplier can follow the procedures in place for submitting a claim for a replacement or repair. In the instance of oxygen, with proper documentation, Medicare starts a new 36-month payment period in situations where lost oxygen equipment must be replaced. The Medicare monthly payment amount for stationary oxygen and oxygen equipment includes payment for all of the different oxygen modalities: concentrated, liquid, gaseous, and also includes payment for portable oxygen contents. Additional payment is not provided if suppliers have to switch patients to a different modality. For example, from a concentrator to gaseous or liquid stationary or portable equipment, for example, because of a power outage. People with original Medicare who are unable to transport their DME to their new location can receive a temporary replacement DME from an alternate enrolled supplier until the beneficiary can return to their original DME supplier. The alternate supplier needs to seek payment from the initial supplier that received the Medicare monthly rental payment amount for the remainder of the paid month, during which the beneficiary relocated or needed to obtain services from an alternate supplier. Original Medicare does not authorize duplicate payments for the same month. Once the rental month for which the initial supplier received payment is over, the alternate supplier can bill for the next continuous month, but the initial supplier of the DME cannot be paid. One of the best things you can do to support someone during or after a disaster is to assist with reconnecting individuals with their healthcare. A good way to do this is to ask the person if they know what type of healthcare coverage they have. An individual's Medicare card is an important resource to begin this process. It is pictured here. Medicare cards are red, white, and blue and will say Medicare Health Insurance and the person's name. If the individual has original Medicare, the card will indicate hospital, Part A, and likely medical, Part B. Medicare beneficiaries should only share their Medicare card information with individuals like their practitioner, insurers acting on their behalf, or trusted people in the community working with the beneficiary like FEMA, state emergency personnel, and others. If someone has Medicare, you should instruct them or assist them in calling 1-800-MEDICARE or 1-800-633-4227. They should have their Medicare card ready. If they do not have their card, they should still call 1-800-MEDICARE. Teletype users can call 1-877-486-2048. The operators on this phone line will be able to answer any questions about replacing or repairing DME and may be able to refer individuals to other case management specialists who can deal with their specific situation. Remember that if Medicare paid for the DME or supplies that were damaged, Medicare will likely pay for the repair or replacement. Working with survivors of disasters and asking them for their insurance card or cards is important because you will be able to identify someone as having Medicare by their red, white, and blue Medicare card. If they have original Medicare, Parts A and B, it will say Parts A and likely B. The medical services are paid for under Part B, which is also the part of the program that paid for their DME. We will discuss Part C in later slides. Due to the nature of some disasters, many people may not have their Medicare information readily available. So how do you help someone who doesn't have their Medicare card with them? Call 1-800-MEDICARE. Visit mymedicare.gov to print an official copy of their Medicare card. Call 1-800-772-1213 for the Social Security Administration. Request that a new card be mailed to their official address on record. Visit ssa.gov. In some emergencies, individuals will need to evacuate to safety. In this scenario, a woman with original Medicare was prescribed an adjustable hospital bed for home use. Due to a prior hospitalization, Carol is discharged from a hospital and returns to her Houston, Texas home with a hospital bed. Soon after, she escapes floodwaters caused by a hurricane and relocates temporarily to her son's home in Tulsa, Oklahoma. The president declares a disaster, and Section 1135 waivers are issued by CMS for the flooding in Houston. Therefore, some additional flexibilities may be in place. So due to a fast-approaching hurricane, Carol had to quickly evacuate. She was able to evacuate to her son's home in a neighboring state, but was not able to bring her DME, her adjustable hospital bed. What should she do in her new location to get a hospital bed? She should contact her DME supplier for a temporary hospital bed or for help getting a temporary hospital bed from a different supplier. If the current supplier is unable to assist Carol, then she should contact 1-800-MEDICARE to locate an enrolled supplier in the temporary location. The alternate supplier who furnishes the temporary hospital bed can start billing Medicare for services rendered starting once the Houston supplier's rental month is complete. When planning to return to her home in Houston, Carol should notify the original and alternate suppliers so the suppliers can coordinate pickup and delivery of the replacement hospital beds. Now we will discuss Medicare Advantage plans, or Part C. Earlier we discussed Original Medicare, which is Parts A and B. Medicare also has Part C, which is referred to as Medicare Advantage or MA plans. Medicare Advantage plans, which are offered by private insurance companies, are plans that cover Parts A and B Medicare benefits, and sometimes other benefits like prescription drug coverage, which is called Part D. Medicare Advantage plans must cover the same categories of DME that Original Medicare covers, but may limit their coverage to specific manufacturers or brands. These plans determine specific pricing for DME, and it can vary by company and plan. After a disaster or emergency, Medicare Advantage plans must ensure that beneficiaries can access or replace their DME when needed. In other words, the replacement of DME during emergencies is treated like any other covered benefit. When medically necessary, the plan must allow beneficiaries to repair or replace out-of-network DME at in-network rates. This means if an evacuated beneficiary needs replacement DME in a new location, the cost-sharing prices they would have paid in their original location must be honored. Also, the plan may waive certain gatekeeper requirements. For example, seeing your primary care provider for a referral before specialty care is authorized. People with Medicare Advantage plans who are temporarily relocated to another service area should contact their plans for information on getting services. If a beneficiary relocates, MA plans must permit coverage immediately, even from non-contracted providers, of all services at in-network rates during the first 30 days of any declared disaster or emergency, or less time if the declaration is less than 30 days. Now we will review how to help people with a Medicare Advantage plan. We spoke earlier about people with Original Medicare and how to help someone by identifying what insurance they have. An individual enrolled in a Medicare Advantage plan may have both their red, white, and blue Medicare card and their Medicare Advantage plan card. As stated before, Medicare beneficiaries should only share their Medicare card information with individuals like their practitioner, insurers acting on their behalf, or trusted people in the community working with the beneficiary like FEMA, state emergency personnel, and others. If someone has a Medicare Advantage plan, you should instruct them to call their Medicare Advantage plan with the phone number on their card. If this is not possible, or they do not remember their plan or have their card, they should call 1-800-MEDICARE. Teletype users can call 1-877-486-2048. The Medicare Advantage plan must cover the same services covered by Original Medicare. In other words, in situations where Original Medicare would pay for DME that were lost, damaged, or destroyed, the Medicare Advantage plan must similarly cover the DME. Again, here is how to verify someone's insurance. If someone is in Medicare Advantage, they should present their plan card. It is important to call their Medicare Advantage plan first, and use 1-800-MEDICARE as a second option. Let's look at another scenario. Mary has a Medicare Advantage plan and uses a wheelchair. She lives in an area affected by California wildfire with a federal disaster declaration. She lost her wheelchair and household belongings in the wildfire. In addition, the medical supply providers in her local area were also damaged or destroyed. In this scenario, Mary needs her DME replaced, but her in-network medical supply provider is not available to provide a replacement. What can Mary do now? The Medicare Advantage plan must allow out-of-network replacement of Mary's DME at in-network rates. Because there is no provider in the network where she normally receives services, she has to go outside her network to get services from an out-of-network provider. She can get services from any Medicare-certified provider or supplier of DME. Additionally, the Medicare Advantage plan cannot require Mary to request an authorization from the plan as a condition for receiving the wheelchair. There may be some instances when Mary may pay more for products and services out of network. If she does pay more, she should retain any documentation showing what she paid, which she can then present to the plan for the reimbursement. She should contact her plan, or she can call 1-800-MEDICARE if she cannot contact her plan. Now that we've covered original Medicare and Medicare Advantage plans, let's take a moment to talk about prescription drugs and how they're replaced in the event of a disaster or emergency. In many emergencies, people are required to evacuate quickly. Following an event like a natural disaster, it may be difficult for beneficiaries to find their prescription drugs or information about their prescriptions. They may have already refilled their prescriptions for that month, so how can they get it refilled? What steps should they take to replace the prescriptions that may have been lost during an emergency? We will address these questions in the next few slides. Now we will discuss Medicare prescription drug coverage. People enrolled in Original Medicare can enroll in a Medicare Part D plan to get Medicare prescription drug coverage. Part D coverage can be provided through a standalone prescription drug plan, PDP, or a Medicare Advantage plan that includes Part D coverage, called a MAPD. Most Medicare Advantage plans are MAPDs. All Part D plans, including PDPs and MAPDs, must provide a standard level of coverage set by Medicare. Original Medicare Part B, MAPDs, and Part D plans cover prescription drugs. The drugs covered by Part B are limited. MAPDs and Part D plans cover considerably more drugs. Although there is no regulatory requirement to do so, CMS expects that plans will cover replacement prescriptions after a disaster or emergency and considers them part of the plan's allowable Part D costs. Additionally, plans may relax refill too soon restrictions to allow people with Medicare to refill prescriptions that may have been lost, damaged, or destroyed. Plans also are supposed to allow out-of-network access to prescription drugs. If a person with Medicare Part D coverage won't be able to return home for a long time, they may want to ask for an extended day supply, a 60 to 90 day supply, of their prescription drugs if prescribed. The person might be able to get the extended day supply from the closest network pharmacy in the area he or she is located, and should contact their plan for help finding a network pharmacy. However, the plan also has to provide adequate access to prescriptions at an out-of-network pharmacy if the person is not able to get the prescription at a network pharmacy. Out-of-network pharmacies might charge more for a prescription than a network pharmacy. If that happens, the beneficiary might need to pay the full price out of pocket and ask his or her Part D plan for reimbursement. Finally, if the prescription cannot be transferred because it cannot be verified with the original pharmacy, or there are no refills left, the beneficiary or pharmacy may need to contact the prescriber. It also may be helpful for the beneficiary to bring the bottle or packaging from the original prescription if available, which of course may not be the case in a disaster or emergency. On a later slide, you can find a link to Getting Medical Care and Prescription Drugs in a Disaster or Emergency Area, which is a resource book with information for these situations. Now we'll discuss how you can help people with Medicare get their prescription drugs replaced. When you ask someone with a prescription drug plan for their insurance card, they may have both their red, white, and blue Medicare card and a prescription drug benefit card. If a person is in an MAPD plan, they may only present their plan card. As stated before, Medicare beneficiaries should only share their Medicare card information with individuals like their practitioner, insurers acting on their behalf, or trusted people in the community working with the beneficiary, like FEMA, state emergency personnel, and others. People with Medicare who are enrolled in a separate Part D plan should contact their plan or call 1-800-MEDICARE. People with Medicare prescription drug coverage through their Medicare Advantage plan should contact their Medicare Advantage plan. People who get prescription drugs through Part B should contact 1-800-MEDICARE. This does not apply to very many drugs. If someone has a Medicare prescription drug plan, you should instruct them to call their Medicare prescription drug plan with the phone number on their card. If this is not possible, or they do not remember their plan or have their card, they should call 1-800-MEDICARE to get their plan's contact information. Teletype users can call 1-877-486-2048. If you're helping someone get their prescription drugs replaced, they most likely will have their Medicare card and a prescription drug card. If a person is in an MAPD plan, they may only present their plan card. Let's review one last scenario. John, who has a Medicare Part D prescription drug plan, lives in the path of an oncoming hurricane and evacuates to his brother's house in a neighboring state just before the hurricane hits. Then he realizes that he's forgotten to pack his high blood pressure medication. The streets in John's neighborhood are flooded, so he doesn't know when he'll be able to return home to access his medication, which he just refilled a week before the hurricane. How can John get an emergency refill of his blood pressure medication? Because Medicare Part D plans typically relax refill too soon requirements in these situations, he should be able to get a refill for his medications. He will need to contact his plan to check on where he can get the prescriptions refilled. Because John is in a neighboring state, he may not have access to a pharmacy in his plan's network. He needs to call his plan for information about in-network pharmacies, and, if none are nearby, out-of-network rules will apply. When someone buys their drugs out of network, they will probably have to pay full price at the time they fill their prescription and get reimbursed later by their plan after submitting a claim. Therefore, they should keep their receipts. Had John, in advance of the hurricane, gone to request an extended amount of medication, the Part D plan may have granted it if it was appropriate to ensure access to the drug and if the drug was prescribed and available. However, since he doesn't have his medication, he will need to contact his plan to check on where he can get the prescriptions refilled. That concludes our discussion on how to help people with Medicare. There are other ways to get help for individuals that are survivors of a disaster, which we will now review. Here are some examples of other options for help. Some individuals who do not have Medicare or Medicaid may have private health insurance plans. They should contact their plans for assistance. The Department of Veteran Affairs also has benefits and resources for veterans after a disaster. The number to call is 1-800-698-2311. FEMA Individual Assistance assists individuals and households through the coordination and delivery of a variety of programs. The number to call is 1-800-621-3362. The next slide will expand on FEMA Individual Assistance. The FEMA Individual and Households Program assists individuals and households who have necessary expenses and serious needs that cannot be met through other means. This can include replacement of DME. However, it is important to remember that if a person has Medicare, you should help them in replacing DME through Medicare before helping them get a replacement through FEMA. Individuals and households must apply for this program online. On the prior slide, we discussed how FEMA offers individual assistance and assistance to individuals and households to support recovery efforts. Those impacted by a disaster can apply online directly at www.disasterassistance.gov, or they can call 1-800-621-3362. There are some instances when an individual may need to apply for and receive DME through FEMA Individual Assistance even though their product was provided by Medicare. This would only be in instances when they were unable to work with their Medicare provider. Individuals should keep in mind that any DME they get through FEMA Individual Assistance would not qualify to be serviced for repairs under Medicare. Using this process would be temporary for individuals who originally obtained their products through Medicare. Generally speaking, FEMA Individual Assistance for DME is available to applicants who are uninsured or underinsured. FEMA cannot duplicate assistance from another source. Additional info is available at www.disasterassistance.gov. The Emergency Prescription Assistance Program, EPAP, is designed to provide prescription and medical supply services to the uninsured residents of an affected area after a presidential disaster declaration or a public health emergency declaration. This program is activated by a Stafford Act declaration or the Public Health Services Act. EPAP must be activated for the uninsured person to receive their benefits. The EPAP's cost is shared between the state and the U.S. government. The EPAP is activated by the affected zip codes within an area that has been declared as a disaster or public health emergency. Eligibility is limited to uninsured recipients in affected areas, which allows these qualified recipients to get their medication and some medical supplies refilled through the EPAP once the disaster or public health emergency and the EPAP is activated. Those who are eligible for the EPAP can have their prescription medications, vaccines, medical supplies, or DME that has been lost or damaged due to a disaster or public health emergency filled or replaced at an enrolled pharmacy. In parting, we want to leave you with some key messages. It is vitally important to reconnect people with their usual healthcare coverage. When you identify someone who needs to replace DME or medication, you must ask them about their healthcare coverage. As we've discussed today, the best way to help someone is to have them call 1-800-MEDICARE, their Medicare Advantage plan, and/or their prescription drug plan. Most likely, if Medicare covers DME or prescription drugs that were lost, destroyed, or damaged due to an emergency or disaster, they can be replaced. As we close out the training, I want to draw your attention to several resources that might be helpful to you as you're working with people with Medicare and assisting them with getting back to their original source of insurance and helping them replace lost DME or prescription drugs. The Medicare.gov Disasters and Emergencies page provides information about getting care during disasters and emergencies. The ASPR Technical Resources, Assistance Center, and Information Exchange, Tracy, Fact Sheet, is where you can find more information about Tracy, which has other trainings and resources related to assisting individuals after a disaster. The Medicare Coverage of Durable Medical Equipment and Other Devices booklet explains Medicare coverage of DME in greater detail. The Medicare and You Handbook includes a section about access to DME and information for people that are involved in a disaster and how to get replacement products. The CMS Emergency Response and Recovery website also has information about emergency response efforts for Medicare beneficiaries. The Getting Medical Care and Prescription Drugs in a Disaster or Emergency Area fact sheet gives information about seeing practitioners, getting prescription drugs, getting additional supplies that were lost, and getting additional supplies to prepare before a disaster. The Contact Medicare link gives information on how to contact Medicare. Next, mymedicare.gov gives information about how to replace a lost Medicare card. Finally, here are several federal government websites where you can get further information, including the homepages for ASPR, Medicare, and FEMA. If you have questions about this training, please reach out to Competitive Acquisition Ombudsman at cms.hhs.gov. Thank you for your participation today,